All right, folks, we're back here at Max Life again doing some home rehab exercises here as well as in-office rehab exercises. We're going to start this video with the lumbar spine or the lower back phase 1. In other words, we're working on just increasing movement. This is where you're going to start. So the first exercise we're going to do on this is simply knee flops. So the knees are together here in this case. Feet are comfortably on the floor. Hands are out on the floor to create a little bit of balance with this. And she's just going to let the weight of her legs drop the knees to one side, keeping the shoulders down both directions, and again, back and forth. And we're going to go through this basically 10 times each direction through here, and it's nice and slow, nice and controlled. You're not using momentum to push the knees back each direction. Notice how her feet stay together even when they come off the ground. Same thing with the knees on there. So that's the first one. The second one now, we're going to extend both the legs out. And again, this probably works better on a hard floor than it does on a bed or some other soft surface because you're going to get more stretch from this. But she's going to take one knee and pull it all the way up to her chest like that. She's going to extend it back out now. Opposite side, coming back up, squeeze, hold for a pause, back out again. We're going to do 10 of these to each side, both directions. Some people will be able to get further than others. You'll probably even notice that one side will be easier than the other. But the key is we're starting to put more movement back in that lumbar spine and more importantly into the pelvis in this circumstance. So that's the second exercise of this phase 1. The third thing we're going to do, now we're going to bring one knee up and we're going to do leg lifts now. So she's simply going to extend that leg up over her body to a comfortable point where there's a stretch and back down, not touching the ground, back up, and then back down again. So she's engaging a little bit of muscles with this as well too, not just the range of motion that goes along with this. And again, 10 times on each side. Keep the opposite knee up while you do this because that's going to be important for the position of your pelvis. That allows it to have more flexion in this situation in the process of what we're doing here. So again, knee is coming back up on something like that. The next thing we're going to do is we're going to go to hip flexor stretches and glute stretches. We'll start with the hip flexor stretch here, which the best way to describe this is simply from a one knee in the ground, one leg out front position on here. Because what happens on this circumstance is that we're trying to stretch her left-sided hip flexor, which falls right down by the hand with her watch there. Because that's going to get tight on a lot of people because of the fact they sit too much. So again, knee in the floor, basically she's making right angles with her knees on both sides. She's going to drive her hips forward on this to elongate that distance at that belt line from her, basically from her sternum to her hip. We want to stretch that distance there. Now she's going to take her arms and she's going to rotate her arms over the opposite side leg. In other words, her front side leg through there. Another way to do it is almost as if you're throwing a bucket over your opposite shoulder there with both arms. You're going to bring it over and you're going to rotate back just a little bit, just like she's doing through here. And you're going to see again the stretch that happens. You'll be able to feel it in the front. So we'll switch sides now. So it's really easy to, again, to start through this positioning here, driving the hips forward. Yep. Torso's up. Notice her torso's up, her neck is up. She's not hunched over in this situation. Now, as soon as I get over here, we're going to rotate that arm over. And this right side, and again, where you should probably feel this at, the majority of this, is right down through this front part of your thigh, up into your abdomen even at that point. She's going to rotate away. Again, it's rotation as well as extension through that torso at that point. So now we're going to move into a glute stretch, which is a pretty easy transition at this point, where honestly, all we're really going to be doing is sitting over top of that leg. So this is probably more of the advanced phase with this. We'll start with the leg just underneath the body a little bit at that point. Some of you, if you can get into this position, great. If you need to start from more of a lunge position to begin with, that's where you may have to start there, just like that. And some of you have to tuck that foot even further underneath your rear end because your knee's not able to bend quite as far. But the whole objective now from this position is she's going to sit back over her rear end on the back there. And the more that ends up happening, you get that glute stretch, that pull that comes through that hip. Now let's tuck the foot back up underneath there again. This is where most people will kind of fall. And even sit back on that foot just a little bit more. Okay. So again, the same thing being the fact that we're going to do that. Now she's going to take her chest down towards the floor. Yep. Through that. And then again, sitting further out to the side of that foot. Rolling the hip out just to get that little bit more stretch. There we go, through that glute on that side. So simple thing. Let's do it from the opposite side here now. So again, sitting back on that hip. Good. Now we'll rotate the foot underneath the body a little bit more. And we're going to sit back, take the chest towards the floor a little bit more. Good. And we're going to sit back just like that. Again, depends on your ability and your mobility to be able to do this, which version of this you're going to be able to do. Some people may be able to stick their foot clear out to the side of them like that. Some people you have to keep it underneath. But either way, that's the start of our phase one. Now the next thing we're going to move to is some foam roller in your glutes and into your IT band, your TFL in other words on there. So we're going to position your body. Basically going to start sitting on the foam roller at this point. And we're going to work on this left side. So she's simply just going to turn her rear end basically so that faces that way, crosses the leg over so that you can expose it a little bit more. And your feet are resting lightly on the ground at this point to get that movement. You're going to slowly move back and forth until you kind of find some of these tough, uncomfortable spots. Then you'll stick out on them just a little bit more. If you want to get even more deep into the glute, we'll take that leg that's extended straight out and kind of figure forward over the top of that knee to expose a little bit more of the glute on the other side. So let's go back to the hip flexor, or the IT band now on the foam roller piece. So we're going to go basically to the side here. And again, all we're doing is moving the body through here just to help break up the adhesions. It's simple through there. Again, the more complex that you want this to be, the more weight you put on it, and you take the weight off the other foot at that point. Most people, this is about all they're going to tolerate before you want to cry doing this movement on here. So again, this can be done on both directions here. The biggest thing is use your foam roller, use the weight of your body to help break up some of the adhesions in here. So again, glute right through there, and we'll move right into the IT band then. So you're just basically moving up just a little bit further. We're still working on those lateral side of your legs. Good. So that includes phase one of the lumbar spine.